Welcome back to a new episode of Skin to It, your guide to healthy skin.
I'm Marlo Sutton, fashion stylist and beauty enthusiast.
And I'm Dr. Sandy Skotnicki, your trusted dermatologist.
Today we're diving into an exciting topic.
We're going to break down everything you need to know about skin boosting and biostimulation with Galderma and share tips to help you care for your skin like a pro.
So grab your notepads and let's get skin to it.
Our sponsor for this episode is Galderma Aesthetics, a global leader in innovative and science-backed aesthetic solutions. With a deep commitment to natural-looking results and long-term skin health, Galderma offers industry-leading treatments trusted by healthcare professionals worldwide. Their portfolio includes cutting-edge products like Sculptra, designed to stimulate collagen production for gradual, long-lasting skin rejuvenation, and Restylane Skin Boosters, which deeply hydrate and refresh the skin for a radiant glow. Whether enhancing volume, refining contours, or improving skin quality, Galderma Aesthetics helps people define their unique skin story. Today, we're going to be talking about one of the biggest trends in aesthetics, a shift from traditional fillers to treatments that actually improve skin quality and structure over time. Instead of just freezing or filling or chasing lines, patients are now looking for treatments that restore, hydrate, and rejuvenate the skin.
Yeah, I'm so excited to talk about this, Sandy. I like that chasing lines.
Yeah. We talked about that with Dr. Day, didn't we? Doris Day, the first episode.
Yeah, and I had never heard that expression before that, but I think it's great. So maybe just the traditional fillers, can you just give us, I know we're talking about treatments that we're using instead of traditional fillers. So maybe just give us
we're gonna get skin to it soon. But traditional, so I think most
hyaluronic
people
acid fillers.
Hyaluronic acid fillers, we're going to define them and sort of discuss what they are, but one of the biggest trends we want to talk about really is biostimulation, which we're going to take a deep dive in.
Okay, I love it. So this episode is brought to you by Galderma, a global leader in aesthetic dermatology. We just watched the Oscars, and I mean, so many of these women, especially women over 60, over 70, who just look so fabulous. And
I know.
I think everyone wants to know what they're doing. And I definitely follow a lot of dermatologists and different doctors on and injectors on TikTok and Instagram. And it is, like you just mentioned, this kind of shift away from that overfilled look and to something that's more natural and glowy and dewy and still plump, but not puffy looking, right?
Well, yeah, I think, and just to preface it, we recorded some of these podcasts earlier, so I think this one is coming out in the summer, but we did just watch, we often have an Oscar party with all our girlfriends. We have to actually start dressing up for that, I was thinking, wearing some gowns or something.
Oh gosh.
And maybe doing some skin boosting before the party, which we're going to talk about.
Yes. Before, after.
Yeah. Well, let's sort of define, what biostimulation is. And it's kind of a buzzword, right? And we were talking about that earlier.
Yeah.
Like everybody's sort of talking about biostimulation. What is it? Well, it's again, different than traditional hyaluronic acid fillers. What we're doing with biostimulators, and Sculptra is the one we're going to talk a lot about, which is made by Galderma, our sponsor for this episode. What it does is it's basically pushing your own skin to produce its own collagen. So you're not just putting something, you're not just, like the thing with filler, traditional hyaluronic acid fillers is you're placing it in the skin, or you're putting a depot, as we call it, over a bone, and it gives you instant volume.
Right.
You're not stimulating your own skin to produce collagen. So that's the definition of what a biostimulator is.
Okay, I mean, that sounds amazing. It sounds like more natural sounding.
It is more natural. I mean, you're using a particle, which we're going to get into, to stimulate it, but what we're trying to get, in essence, is a bit more of a natural look, rather, because if you lose so much volume, like if you're in your 60s or late, like Demi Moore or something, if you put so much volume in to correct that sagging jawline, you look overstuffed.
Right.
Yeah.
And that's just a terrible look. It really is. And like we just said, it's amazing how, from what I've seen, whatever people are doing, it is just so much more natural. It's really almost like they're aging, but just in this really beautiful way.
Did you see Goldie Hawn? Like,
fantastic.
She's 79. She looked fabulous.
Yeah.
And I think one of the questions we were talking about earlier is actually, can you dissolve it?
Yeah.
Yeah, you were asking me that.
Yeah.
And you can. So if you have, like if you want to switch to the biostimulator, what we're going to talk about, but you have all this filler, you can, we basically can inject hyaluronidase, which is an enzyme that can break down the hyaluronic acid filler.
The filler.
And I think some people have had that done, but it does
Right.
naturally go away.
Yeah.
Traditional hyaluronic acid goes away in about 12 to 14 months.
Right. Because, you look at a lot of, on TikTok or on Instagram, you're seeing these kind of side by sides with some of these actresses, even 5-6 years ago, and they look better now.
Mm-hmm.
So they looked almost had, like we were just saying, that kind of puffy look.
Mm-hmm.
And it's almost like the filler wasn't necessarily in the right place, where now there's just so much more harmony.
Yeah, I think some of that, like the thing about traditional hyaluronic acid, with any procedure that you're doing, it's operator dependent.
Sure.
I mean, you have to know where to put it. You have to also know when to stop.
Yeah.
Right.
But given that most of these, we're talking about these actresses in Hollywood, you're guessing they're going to some really high end.
Some of the best injectors in the world are from Canada.
Oh, there you go.
Yeah. So
you should come here.
Yeah.
Because let's really get into how do we biostimulate our skin? I mean, how does Sculptra actually work? I think this is fascinating.
Well,
I'm so excited.
Yeah. So one of the products we're going to talk about that Galderma makes is called Sculptra.
Right.
So Sculptra was sort of one of the first to market to biostimulate the skin. So make the skin produce collagen. So how does it work? So what is Sculptra? Sculptra is poly-L-lactic acid, or PLLA. When it's put into the deeper layers of the skin, the dermis and the subcutaneous tissue, it will stimulate fibroblasts, which are the cells that make collagen, to produce type 1 collagen.
Okay.
Yeah.
And so how many types of collagen?
Oh, there's many, but the main one in the skin, 90% of our body is actually type 1 collagen. So that's the one that gives us like that oomph, that tensile strength, right? So that's the one you want to stimulate.
Okay. And that's the one we lose.
Well, we lose collagen as we age. I mean, it starts kind of at the age of 30.
Wow.
We start to lose 1% collagen per year after that. And menopause, when we talked about in the menopause
and then
episode,
it just falls off a total cliff, right?
It falls off a cliff. Yeah, you lose a lot of collagen in the first few years after menopause. So estrogen has a stimulatory effect there. But, when you gradually stimulate collagen, you're going to gradually sort of reform the structures that have lost. So we get a lot of bone absorption as we age, like our jaw absorbs and it moves backward. Okay. Our fat pads deplete, our collagen and our cheekbones go like everywhere in the skin. So you can immediately fill it, but you can, with the biostimulator Sculptra and poly-L-lactic acid, you're actually making your own skin produce the collagen slowly over time to resculpt the face. That's why it's called Sculptra.
Okay, that's so cool. So when you, like you were just saying, when you go to an injector's office and you have regular hyaluronic acid filler, you immediately, like you walk out, immediately you see the result.
Yeah.
So for this Sculptra and biostimulators, do you see it right away, or
No,
it takes time? And
so,
how long does it take to sort of to get the full effect of it?
So it's different in different people, but generally, like talking just general concepts. So you go in, you inject it, and we're going to talk a little about how you inject it and all that kind of stuff. You get sort of swelling effect from the volume that you're putting in, and that goes away in a couple days.
Okay.
And then slowly over several months, you're going to stimulate that collagen production. So you get a gradual filling over several months. And we're going to talk about optimal timing and how often and that kind of thing. But it takes time. You don't see, it's not an immediate result like hyaluronic acid fillers. And some people don't like that. Like
they want to get the bang for the buck. They want to see it right away.
They want to see it right away. So it takes, you really have to educate and explain to the patient how it works. Okay. And that's one of the great things about this podcast is they're going to walk away in 30 minutes.
You're going to really understand.
Yeah.
So use these words, microparticles and fiber and polylactic acid. I mean, I am reading this PLLA particles, which is in Sculptra. I mean, it sounds all synthetic-y and kind of scary.
Yeah.
And so where are these coming from? How did they figure out that they could use it this way? Like can you explain
Break
this
it
to
down.
us? Yeah.
Okay. Let's get into it. Well, PLLA, poly-L-lactic acid, it is a synthetic polymer, but it's compatible. That means our body kind of sees it as a foreign, but it breaks it down very easily into carbon dioxide and water. So it's biodegradable. We're going to talk a little bit about the history, and that really is going to inform the listener that how safe it is.
Okay.
So it is derived from lactic acid, which is a naturally occurring substance in our body, but it is, as I said, biocompatible and biodegradable. It's FDA approved, and it was first FDA approved for sutures.
Okay.
So,
like the ones that dissolve on their own. Like
yeah,
not the ones you have to get taken out.
that's right.
Okay.
So when I had my C-sections, and they sewed me up internally with stitches, they could have used poly-L-lactic acid sutures.
Okay.
And so your body naturally dissolves these with time. We know this, and they were first introduced in 1970. So we know this technology has been around a long time. It's been used in medicine for decades. And not only when it's dissolved, it's stimulating some collagen. So when you cut the deeper, you cut the uterus, you cut then the deeper layers, you cut through many layers when you have a C-section or any abdominal surgery, the suture not only brings the tissues together, but it's stimulating collagen production around the wound.
Wow.
So safety isn't, from that point of view, we have a long lineage of this molecule particle, as you said. In 1999, it was approved by the FDA for medical reconstruction of patients who had lipoatrophy, so that's loss of fat in the face from HIV medication.
Wow.
And I actually have done patients over the years because I've been at this a long time. We don't see this sort of loss of fat on the face of patients who have HIV infection anymore because the medications have improved. So the initial antiretroviral medications to treat HIV patients caused this loss of fat. And it was a real stigma because then patients or people in the community, especially in that community, would know that this person has HIV because they're on this medication. So it was really great for those types of patients. It stimulated, you need a lot of volume to repair that. And that's where Sculptra really was a game changer. Okay. And then in 2004, it got aesthetic FDA approval to treat wrinkles and volume loss with aging. So it's been around a long time.
Yeah. So we briefly mentioned this. Women's, you said, start to lose the collagen in their skin.
Way too soon.
Way too quickly.
We all do. Not just women, everybody.
Oh, everyone.
Yeah.
Okay, so everyone loses collagen.
And also in our joints and, our tendons. And
right.
I remember one doctor I was talking to, or I was listening to, every time we take a breath, we age.
Ooh.
Because every time you breathe, you produce superoxide radicals and it's damaging us, right? So you're going to accelerate that with pollution and, if you smoke and sun rays. So, collagen is constantly getting hammered. So anything we can do to replace
replace that collagen. Yeah. I mean, it's such a buzzword. And we've talked about, collagen supplements and collagen things. And I guess you just got to try everything, right? But so
actually, I have a funny story there. It's not a funny story, but in some cultures, they eat everything. Like they eat the chicken meat, but then they eat the tendons and part of the bone and everything. That's a lot of collagen.
Okay.
So there are, like, in these cultures I'm talking about, mostly Asian cultures, like they age better. I think it's because they're eating
so much collagen.
They're eating all that collagen. Yeah.
Ooh. Okay.
So I don't think I'll be eating tendons and bones anytime soon, but I might take it in a powder. But yeah.
It's so interesting. Mm-hmm. Okay, so let's get back onto this PLLA. Mm-hmm. So these poly-L-lactic.
That's good. Poly-L-lactic acid. Yeah.
Poly-L-lactic acid. See, I'm getting there. You're getting there. So how long is it actually going to last in our skin?
So this is a big question. So because people are like, that's foreign substance. How long is it going to be in skin? Well, we already talked about the safety and how it's been around in sutures for a long time. So your body does degrade it. It metabolizes it, breaks it down into carbon dioxide and water. So it does go away. I read various areas, but the common adage is it lasts months, right? Okay. But the stimulatory effects of the collagen production lasts up to 2 years.
Okay.
So when you get a series of Sculptra treatments, we're going to talk about, timing and all that kind of stuff later. The particles are gone, go away eventually over months, but the collagen stimulation effects last for 2 years. Kind of 2 years is what we say. Yeah.
Wow, that's great. So let's say you did back-to-back treatments of Sculptra. Mm-hmm. Are you going to get even longer than 2 years?
No. So we can jump in and sort of talk about.
Sorry, I'm skipping around here.
That's all right. Doesn't matter.
It just came up.
You're most of the time when I'm counseling a patient, I'll say we do several injections over several months. Okay. And you kind of do a vial or two each time. So it really depends on how depleted the patient is or their age. Like if I'm doing an older patient who's lost a lot of volume and we kind of want to resculpt their face and sort of, bring their cheekbones and their jawline up without giving them that overstuffed look, it's going to take more treatments and more vials. But a younger person might only take one treatment or two. But we do several at the beginning. And again, it's tailored to the patient. And then that's going to last 2 years.
So let's get back to how this Sculptra is different from hyaluronic acid.
Traditional
fillers.
hyaluronic acid, yeah.
Because I know that Galderma also makes those as well.
Yeah, and they were actually one of the first. So Galderma makes a product called Restylane, and there's a whole suite of products. Some are you put into the cheeks for a lift. That's called Restylane Lift. It's going to be stiffer. It's going to be firmer. Okay. Softer ones for the lips. Restylane Kiss. So there's a whole suite of hyaluronic acid fillers, and so hyaluronic acid is a natural occurring substance in the skin and the bone and joints, and also our eyes. Okay. So it absorbs a lot of water, so it makes those tissues supple. Okay. And as we lose it over time, we look more sallow, we look less, plump and the rest of it. In 1996, Restylane came out with their first non-animal derived hyaluronic acid filler. Okay. And it's made by bacterial fermentation. And so...
and that's what they use now.
That's what they use now. Almost all across the board for all fillers. Mm-hmm. Before that, it was made from rooster combs, which is kind of weird. Okay. I can't remember all that. I was going to reread it, but I thought, who cares? It's old news.
It's old now. We're not using that anymore.
Yeah, we're not using it anymore. And so the thing about fillers is that, again, we put it right into the skin. You get immediate volume correction. So you want to lift that cheek. You want to make that lip a little bigger. Whereas Sculptra and poly-L-lactic acid take time.
Slow burn.
And stimulate the collagen gradually over time.
I want to actually know if Sculptra is safe for everyone, or the people who it's not recommended for them to
So what are the safety concerns?
Yeah. What are the safety concerns? And biostimulation in general, what are the safety concerns?
Well, there's other biostimulators, but the Sculptra poly-L-lactic acid biostimulator is safe, pretty much for all age groups across the board. There's a few contraindications. There are very rare cases of allergy. I've never seen it. It's reported in the literature. And in that case, they'll get like redness and irritation around where it's injected. It's not recommended for patients who have a history of something called keloid scarring or hypertrophic scarring. We don't use it in those types of patients. And then patients that have autoimmune disease. So, things like ulcerative colitis, rheumatoid arthritis, anything where the body is kind of attacking itself.
Yeah, because this will stimulate a reaction.
So let's actually talk about why. Yeah, why in autoimmune disease can't you use this biostimulator? Stimulator. What is a biosimulator?
It's a biostimulator.
Yeah, biostimulator. So, okay, so if we go back to how it works, so you inject it into the deep layers of the skin.
Yep.
And you're going to sort of stimulate fibroblasts, but what happens is it creates a little bit of an immune reaction. Mm-hmm. So an inflammatory reaction, which is good because that gets those fibroblasts producing collagen type 1. But if you have an autoimmune disease, your internal inflammation is already a little higher. Okay. And so we don't want to jumpstart that in any way. And actually a really interesting story here around COVID that we were talking about earlier. So when you get a COVID vaccine, you get this huge inflammatory response in the body. And what we noticed in medicine generally is that patients that had autoimmune conditions like Crohn's disease or ulcerative colitis or rheumatoid arthritis, their disease flared. Wow. We even saw it in dermatology with psoriasis, a condition called psoriasis. So how I explain this to patients, and I like analogies, is like your immune system's like an army. It only has so many soldiers. And a lot of these soldiers are sentinels. They're kind of around your body, like looking for bad guys, keeping a watch, right? Mm-hmm. So when you do get a vaccination, you get this huge, brisk immune response where a lot of the soldiers they leave their posts. Okay. So that's why the inflammatory response will often increase in patients who have autoimmunity. And we saw it a little bit with injections. So when some people had fillers or biostimulator, they had a bit of a swelling or immune reaction, which went away. But it's interesting. The workings of the immune system, we're going to learn a lot from COVID over the next years, I'm sure.
Wow. So, Sandy, let's get like to the kind of brass tacks and actually, how is Sculptra injected? How are you injecting it in your office, and how is it different from traditional fillers?
Yeah,
like
so
in terms of injecting it.
In terms of injecting, it's very different. And that's sometimes the harder sell for patients. Like, with a filler, you go grab a box of Restylane off the shelf, I inject it, you could leave with immediate results, right? With Sculptra and this particular type of ingredient, you have to inject it with a cannula. So you can inject it actually with a needle. I usually use a cannula. So cannula is a needle, but it's blunt-ended. So there's no sharp component to it. So you make a little hole, and we do a lot of Sculptra like on the lateral face. So like temples, forehead, lateral forehead. So that's outer forehead, outer cheek. And we're kind of trying to pull and sculpt that and produce collagen to sort of lift you up. And sculpt the face. So we inject with this cannula, which is blunt-ended. You make a little hole in the skin, you put it in, you kind of something like a fan technique.
Okay.
And so it's different. If somebody hasn't had a cannula before, you're going under the skin, and it seems a little
odd.
bit, yeah. But once you get, it's less. Generally, it's less painful because it's not needles, and less bruising because you only need a few injection openings.
Points.
Yeah. And then there's a really important thing post-injection. So again, traditional hyaluronic acid fillers, you go in, you get some, you leave, that's the end of it. You might have a bruise, whatever. With Sculptra, we call it the 5-5-5 rule. So you have to massage for 5 minutes, 5 times a day for 5 days. Because you want to massage the poly-L-lactic acid to sort of make sure that it distributes evenly.
Okay.
Because you don't want to have you can get little nodules sometimes, bumps.
Stuff.
Yeah.
Okay.
So it is very different. And then again, swelling for a few days, which totally goes away. Spent all this money. You're like, I don't see any difference.
Right.
And then you have to wait for a few months to see the difference.
Right. Yeah. Obviously trusting your injector, knowing that they know how to use the product properly is
very important.
Extremely important.
Very important. Yeah.
Okay.
And sterile technique is really important with this product. Like you have to make sure the skin is sterilized, all the makeup's removed, and it's done properly.
Right. Okay, another common question and something I wanted to ask you, can you have a facelift? Like let's say you've been doing Sculptra for a while or whatever, can you have a facelift?
It's a big question. It's a big concern, not only for patients, but also for injectors. I was just at a meeting that Galderma had, a dinner meeting, and we had a plastic surgeon, present. It was, can you imagine? Only doctors could do this. So we're eating at a steak restaurant, and he's showing all these slides of people's faces open and with, like mid facelift, right?
Right.
And he's kind of showing us where the filler is, right, in the skin. So the filler is put in, like traditional hyaluronic acid is put in the skin. Sculptra is a little deeper, but most of the plane of where you're kind of cutting with a facelift is below that. So it doesn't really interfere with the anatomical structures that are addressed in a facelift. But it is interesting. You can see, he showed us actually more hyaluronic acid, which is kind of this gel-like substance. You could see it when he was dissecting. He had little videos. Sculptra, as we already talked about earlier, is metabolized into carbon dioxide and water. It goes away. The collagen producing stimulus. So you can have a facelift after having Sculptra.
There you go. Okay. So where else, besides the face, where else are we using Sculptra? Just to sort of summarize this,
because I actually know the answer to that.
Well, I know the answer because we were talking about it, but I thought maybe other people would find this interesting. Yes, apparently the Kardashians use it.
Yeah, and we did talk.
I did in their butt.
I did research this after because she's been very open about using this product Sculptra for her butt enhancement, and I don't know about the other members of her family, but. Yeah, it's used. So, think about this as you can stimulate your own body to make, collagen to fix volume loss. So it's not just in butts. And actually, by the way, I went to a meeting and they had a live demo of somebody came in and had their buttocks injected on the stage. It was interesting to watch. And we're not going to see the results of that for a few months, but you can use it in much more I guess, beautiful ways, like after a woman has a breast reconstruction and they have depressions. You can use it to enhance a depression or a divot. You could use it in a condition called pectus excavatum, where people they're born and they have like a depression.
Yeah.
And it's been really great for us. So it's not just craziness, right? You can also use it in hands and necks, and I have not, and I have not done it in buttocks. I'm going to leave that to my plastic surgery colleagues. But yes, and they have actually FDA approval for injection in some of these other locations outside of the face.
Okay. Okay. So I would love to switch now to skin boosters.
Right.
And this is one of the perks of having Sandy as a friend and doing this podcast. Is I get to be a little bit of a guinea pig.
Yes.
And
we were trying to do it before the podcast, but we've been so busy recording the podcast.
Yes, but I'm going to get a really good boost of my skin. And I mean, even the word skin boosters just sounds so great because it like enhancing what you already have, making things glow.
Yeah, it's really
boosting it.
Glow
right?
is a buzzword. So you're definitely going to get a glow out of skin boosting. Okay, so what is skin boosting?
I mean, who doesn't want that, right?
Yeah. Well, so Restylane Skin Boosters is a trademark. So they've trademarked this sort of skin boosting term. And you're using, again, we're going back to traditional hyaluronic acids. And so one of the ways I like to explain how this differs is, let's say we take a Restylane product called Lift. Okay, so that's going to give you that, put it in the cheekbone and give you like a oomph,
Lift.
right? So if you were to take a syringe of that and push all of the product out onto the counter, kind of look like a piece of spaghetti, kind of stiff, right? If you take Restylane Skin Boosters and you push that out on the couch, it's just like a blob.
Okay.
So, because hyaluronic acid is like a gel kind of thing, and if it's cross-linked, if it's really cross-linked, and depending on that, there's like something called Nash cross-linking, which really makes it very, very stiff.
Okay.
That's going to give you too much stiffness, too much volume. That's not what you want. So with skin boosters, there's virtually very little cross-linking. So it's basically not giving you any volume. It's not giving you a lot of stiffness. It can give you some texture. Okay. But what it's doing is hydrating your skin, because hyaluronic acid is what gives you that plumpness.
Attaches to the water molecules,
yeah,
right?
So it's going to give you that skin quality and glow without any volume.
Right. And so I'm like, sorry, my question is, I guess sounds like it's something that's good for many age groups.
Yeah.
And even starting, for younger skin, this could be maybe something that, doesn't seem as invasive, maybe?
Well, I mean, young people. So let's start with who are the best candidates. I mean, so essentially you just sort of said it, anybody.
Right.
Okay. Anybody that wants some radiance, some glow, some texture. It's great for dull skin, for photo age skin, for, dry skin.
Right.
And it's good. Like, okay, so young people, a lot of young people wanting stuff done. Okay. When you're in your 20s, you haven't gotten a lot of volume loss.
Right.
Okay. So putting in like this, you see these actresses that have so much filler, they look old.
Right. It can age you.
Yeah. So skin boosting is a way of getting some fill without having any volume. So, in a young person, so what we can do is we draw a grid on the face with an eyeliner, like a white eyeliner.
Yeah.
And with each area of the grid, you're putting a micro droplet of this skin boosting uncross-linked hyaluronic acid. And so it's almost like liquid moisturizer. Wow. So you're putting it right into the skin.
Right into the
skin.
Right
into the skin. So younger patients, mature patients with photo damage, so that dry looking pallor, like you can kind of give
fine
them
lines.
And then fine lines around the mouth, around the eyes where we don't want volume.
Right.
So that's what I want to do with you. You see Marlo, we can't see, the listeners can't see her, but she beautiful,
what she wants to do.
lovely, and she has some lines around her mouth that she would like to treat. So I kind of, when I use it in this situation around the mouth, I kind of talk of it like it's an eraser. So I put the needle right into the line and we do micro droplets and you can see the line kind of just go away.
Oh, that sounds like too good to be true.
Yeah.
And how often are you doing these treatments?
Well,
like how long is this lasting?
It doesn't last as long because again, the cross-linking is what makes the filler, the hyaluronic acid sort of stay in the skin without being absorbed so quickly. Okay. So again, we can do it in the face around the lines. We could do it in the neck, the décolleté, hands even. And how often? I mean, it all comes down to price. I mean, these things get expensive. So I do a one-off sometimes just around the mouth, around the eyes. You can also do it every month for 3 sessions. Like a lot of people sell it that way for the face. Like you do the whole cheek and jaw area, neck area. and you do a couple sessions, like 3 sessions over 3 or 4 months, and you get a really good boost.
Yeah, I might need that.
Yeah, it just depends on your budget and how much glowing and boosting you want.
Lots. Okay, so let's wrap this up. And Sandy, I like this term as well. So for our listeners who are interested in needle therapy, so it's anything that they might want to do that has some kind of an injectable. What we learned actually with one of our dermatologists that we spoke to on our first season, Dr. Day, it's so great to sit down with your injector and make a plan.
Blueprint, I think she called.
Yeah, a blueprint. So what you would like to achieve realistically, and look at your budget and how you want to kind of spread it out, and what you think is going to be most beneficial for you, depending on your age and, what state your skin is in. So I think, I think that's really a great advice that I got, because sometimes, you go in and you talk and you think you want all this stuff done, but you need to.
A lot of people just say, I don't like this line. And I say, well, there's a lot of reasons for that. It's like, we're not going to put filler just in that. So we have to look at your face from a 360 view, or get a blueprint, and what we're going to do over the next 6 months to a year. So if somebody is okay with getting needles, and so they want some needle therapy, let's look at the sort of categories. So you can do traditional hyaluronic acid filler, which is going to give you a lift and give you volume from your cheeks, etc., or your lips to give you some volume. And then we're going to look at injecting something called a neuromodulator, which is going to soften the muscle between the eyes and around the eyes, so your crow's feet. And then we have skin boosters. So let's say you're younger, you don't have a lot of volume loss, you just want some boosting, you want some glow, you want some hydration of the skin. We could craft, 2 to 3 months of how many you want, how often, your budget. And then, of course, biostimulator with Sculptra. If you're older, you have advanced volume loss. We also would sort of plan that out as a blueprint over a year. And then, we can also, outside of needle therapy, is lasers and all that kind of stuff.
Stay tuned for the next episode.
Well, we have a great episode on lasers in season 1.
Season 1, yes.
Yeah, so needle therapy, that sort of looks at it from a broader point of view, and not just chasing lines, but looking at your face from a full 360 view.
Yeah. Well, I guess that sort of almost answers my last question, which is really, this sounds like that's the future of skin rejuvenation, really.
Yeah, I know. I think we're not just talking about filling and removing lines. We're talking about rejuvenating the skin, hydrating the skin. You want to look youthful. You don't let's talk about Demi Moore. She's 60. She looks like she's 40.
63. Yeah.
And is she 63?
Yeah.
Wow. And I think, she obviously has a deep pocketbook, but she wasn't looking as good a few years ago. Yeah. So it's changed. Maybe a little bit of plastic surgery, maybe a little bit of biostimulator, maybe a little bit of laser. So it's not just about filling the face and removing wrinkles.
Yeah. Okay. Yep. I love that. Well, listen, I think that's a wrap. A huge thanks to Galderma for sponsoring today's episode. If you enjoy this, please do not forget to subscribe, and we will see you next time on
Skin to It.
Skin to It.
Thank you for listening.
Thank you. Please let us know what you thought of today's episode.
If you have any questions or thoughts, send me a message on social at Dr. Sandy Skotnicki. And don't forget, all the links and resources we mentioned are in the show notes.
And if you haven't already, please subscribe and leave us a review. It helps us to bring you the content you love.
Until next time, take care, and we'll see you next week on Skin to It.